Good morning, everyone. I'm excited to welcome you to today's presentation. Today, we'll be discussing a very important health topic, low WBC count, its causes, and some helpful tips to increase it. The title of our session is Low WBC Count, Reasons and Tips by Paras Hospital's Experts to Increase. Over the next few minutes, we'll explore what causes low white blood cell counts, why it matters, and practical ways to improve your health. Let's get started. White blood cells, or WBCs, are really the first line of defense our body has when it comes to fighting allergies, infections, and other threats. They play a critical role in maintaining a healthy immune system, helping us stay protected. When the WBC count drops, a condition known as leukopenia, our body's ability to defend itself weakens. This can lead to adverse reactions, making us feel unwell and more susceptible to infections. That's why it's so important to address low WBC counts immediately. You can stay informed by checking the latest news from Paras Hospital or by connecting with their experts to understand the causes, get tips, and learn about other important aspects related to immune health. When we talk about healthy white blood cell counts, experts at Paras Hospital suggest that a typical range for a healthy person is between 4,000 to 11,000 WBCs per microliter of blood. If the count drops below this range, it could indicate a health issue that needs attention. White blood cells, or leukocytes, are actually divided into 5 different types. These include lymphocytes, eosinophils, neutrophils, monocytes, and basophils. Each of these plays a unique role in our immune system. Think of leukocytes as the soldiers of our body's defense system. They are responsible for locating and fighting off bacteria, infections, viruses, cancerous cells, and other threats. These cells are produced in our bone marrow and then circulate through the bloodstream, constantly patrolling for any signs of trouble. Understanding these different types of white blood cells helps us grasp how our immune system works to keep us healthy. They're always on the move, searching for any signs of infection or illness, ready to respond quickly and effectively. These are just a few symptoms you might notice when WBC levels are low. But it's important to understand that when the condition becomes more severe, it can lead to much more serious issues. In some cases, it can even result in autoimmune diseases, bone marrow disorders, or, in the worst cases, cancer. Some common signs to watch out for include shortness of breath, sore throat, mouth ulcers, and constant infections. You might also experience fever and fatigue, which are often signs that your immune system isn't functioning properly. Now, when we talk about leukopenia, or a low white blood cell count, it generally means having fewer than 4,000 WBCs per microliter of blood. This low count makes your body more vulnerable to infections and illness because your immune defenses are weakened. So, what happens when your WBC count drops? Well, you're at a higher risk of developing recurrent infections, slower recovery from illnesses, and even more severe health problems if left unchecked. That's why understanding these symptoms and the significance of a healthy WBC count is so crucial in maintaining overall health. When it comes to low white blood cell counts, there are several factors that can contribute. For example, autoimmune disorders like lupus can damage or reduce WBC production. Lifestyle choices also play a role. Excessive alcohol consumption, high stress levels, and other habits can negatively impact WBC levels. These are important because they show how our body's immune defenses can be compromised by both internal conditions and external factors. Now, a critical condition to understand is when WBC production is severely affected. This includes serious disorders such as leukemia, aplasia, lymphoma, and myelodysplastic syndromes. These are bone marrow disorders that directly interfere with how blood cells are produced, leading to a decreased WBC count, which can leave the body vulnerable to infections. Nutritional deficiencies are another key area. If you're not getting enough iron, folate, or vitamin B12, your WBC count can drop. And this often happens if your diet lacks balance. Malnutrition can have a significant impact on your immune system's ability to fight infections. Medications also play a role. Some drugs, especially chemotherapy, corticosteroids, and certain antibiotics can suppress WBC production. This is often a side effect of treatment, which is why careful monitoring during medication use is so crucial. Infections are another major cause. Viral infections like influenza, hepatitis, or HIV can lower WBC counts. Chronic infections, such as typhoid fever or tuberculosis, can also have this effect, weakening your immune defenses over time. Finally, if we look at real-world cases like the Paris Hospital study, we see how these causes come together. Understanding these links helps us grasp why low WBC counts happen and how we can approach prevention and management. So, in summary, a low WBC count can result from autoimmune issues, lifestyle factors, serious bone marrow disorders, nutritional deficiencies, medications, and infections. Recognizing these causes is essential for diagnosing and effectively treating affected patients. Now, let's talk about some additional ways to support your immune system and keep your white blood cell count healthy. First, it's important to aim for adequate sleep, as rest plays a vital role in immune function. You might also consider taking certain supplements like folate, zinc, and vitamin B12, which help maintain the right levels of WBCs. You may not realize it, but chronic stress can actually reduce WBC production. To counteract this, I recommend incorporating relaxation techniques into your routine, such as deep breathing exercises, meditation, or yoga. These methods help manage stress and strengthen your immune response. Moving on to stress management specifically, avoiding unnecessary hospital complaints and opting for activities like cycling, swimming, jogging, or walking can make a big difference. Aim for at least 3 hours of exercise per week. And if you have any underlying health issues, don't hesitate to discuss them with your healthcare provider at Paris Hospital. Remember, regular exercise is key to staying healthy and boosting your immune system. Staying well hydrated is also crucial. Drinking at least 2 liters of water daily helps transport nutrients to your bone marrow and flush out waste and toxins. Speaking of nutrients, certain elements are especially important for increasing WBC count. For example, selenium and zinc are vital, and you can find them in foods like beans, red meat, and spinach. Iron is another critical element, necessary for producing healthy WBCs and RBCs, which you can get from leafy greens, eggs, beans, and meats. Vitamin B12 combined with folate is also essential for immunity. You'll find these in citrus fruits like grapefruits, lemons, oranges, as well as bell peppers, broccoli, and strawberries. Additionally, vitamin C is recommended, and dietary modifications suggested by Paris Hospital can help optimize your intake. So, incorporating a variety of these foods into your diet is beneficial. Finally, choosing a balanced diet overall is fundamental. Following these guidelines and consulting with healthcare professionals at Paris Hospital can significantly improve your WBC count and overall health. In case the situation becomes critical, it's reassuring to know that the healthcare experts at Paris Hospital can recommend various medical treatments. These include options like growth factors, which help stimulate blood cell production, bone marrow stimulation procedures, and appropriate medications tailored to the patient's needs. Additionally, I encourage you to read the Paris Hospital case study and stay updated with the latest news from Paris Hospital. Doing so can give you a clearer understanding of how they manage cases involving white blood cell counts and the advanced care they provide. To wrap up, remember that staying informed and understanding the available treatment options is key to managing health effectively. Whether through medical interventions or staying updated with hospital news, being proactive is always beneficial.